Why does the most expensive healthcare system in the world leave so many people behind? Dr. Steffie Woolhandler. She is internationally known for her groundbreaking why US healthcare system is so expensive.
People don't talk enough about, and that raises the prices in three important ways.
Do you think that our healthcare system is also delivering at the same higher level?
American people are very upset because in the year prior to dying, more than half of Americans had a serious
Healthcare costs are rising faster than ever, yet millions of people still struggle to access basic care. Recent research shows a troubling pattern. Countries that spend far less than US often achieve better health outcomes, while Americans face high rates of medical debt, delayed care, and preventable illnesses being looked after less. Large population studies over the past years have shown that lack of insurance and underinsurance are strongly linked to higher mortality. They're linked with worse clinical disease control and widening health inequalities. Why does the most expensive healthcare system in the world leave so many people behind and is underachieving? And what would it actually take to build a system that puts patients before profits? Welcome to another episode of Khan Clinic. I'm your host, Dr. Amir Khan, and today I'm honored to be joined by one of the most influential voices in healthcare system, Dr. Steffie Woolhandler. Dr. Woolhandler is one of the most influential physician research in healthcare policy today, a primary care physician, a public health expert, and a professor at Harvard Medical School of Medicine. She is internationally known for her groundbreaking research on healthcare costs, insurance gaps, and inequalities in the US healthcare system. Dr. Woolhandler, welcome to the show.
Well, glad to be here.
Let's start in asking the first question. From your experience, what do you think is the biggest myth people believe about why US healthcare system is so expensive?
Okay. Well, people don't talk enough about the healthcare system being expensive because of profit making. And the United States has the most profit-oriented, most privatized healthcare system in the world. And that raises the prices in three important ways. First of all, the profits themselves are money taken out of the healthcare system and put into the pockets of billionaire investors. And it's a lot of money. There's been $2.6 trillion removed from the healthcare system by profits alone in the last 19 years. It's all that insurance registration and co-payments and prior authorizations, prior approvals, denials. That's all the administrative work involved in extracting profits for profit-oriented insurance companies and providers. So that's the second way that the prices are pushed up. The third way is that profit seeking really warps the actual delivery of medical care. So hospitals will often be providing services that pay well, elective surgeries for joints.
So if we have one of the most profitable systems in the world, do you think that our healthcare system is also delivering at the same higher level?
Okay,
and is it able to provide care to all Americans, not just those who have insurances or able to pay higher premium for their insurances?
Well, if you've been following the news, American people are very upset because they believe that life is not affordable in the United States anymore, but particularly health care is unaffordable. And in our own work, we find that more than one out of every 4 Americans will have problems affording health care over the course of 4 years. When we were able, in this article that we just published in JAMA Internal Medicine, to look at a cohort of people, a group of people, and follow them 4 years in a row, by the end of that 4 years, more than 1 in 4 had a problem affording medical care. The other thing we found in that JAMA Internal Medicine study, which actually appeared just last week, was that in the year prior to dying, more than half of Americans had a serious problem affording their care. More than half of people who were dying were unable to afford their care.
What a remarkable journey we've just experienced together. The path to health isn't always straight, but it's always worth the effort. I hope today's conversation inspired you to take the next step in your wellness journey, armed with new knowledge and a fresh perspective. If today's episode left you inspired, share it with someone who need to hear this. Give us a thumbs up and your opinion. Keep exploring, keep evolving, and we'll see you in the next episode of Khan Clinics.